Thank you for joining us for Working Within Rural Communities, the Unique Benefits and Challenges for Substance Misuse Prevention Professionals, with Isaac Wolf and Sarah Myers, with assistance from Erin Ficker and Michelle Majors. This presentation was prepared for the Great Lakes PTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The opinions expressed in this webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services. The PTTC believes that words matter and uses affirming language in all activities. I want to share a few housekeeping items with you. First of all, I've got a toolbar that's in the way, so I'm sorry. These things will also be posted in your chat. If you have technical issues, I'd be happy to help you. My name's Rebecca Buller or Chris Gabrielson. If you would individually message us in the chat section at the bottom of your screen, we will assist you. If captions or live transcript would be helpful, please use your Zoom toolbar to enable by selecting live transcript. AI note taker options, please do not activate an AI note taker application. We do not allow this for several reasons, and we will ask you to disengage. If you do not, we will remove you from the Zoom room. Questions for our speakers should be put in the Q&A section, also at the bottom of your screen. This helps us so we don't lose them as the chat scrolls by. So please be sure to use the Q&A for your questions. You will be directed to a short survey link at the completion of this webinar, and we would appreciate it if you could fill it out. It only takes about 3 minutes, and it helps us improve our offerings and report to our funders. And finally, certificates of attendance will be sent out via email to all who attended this webinar in full. It can take up to 2 weeks to receive those certificates. And now I want to turn things over and introduce you to our presenters, Isaac Wolf and Sarah Myers, and we will also be hearing from Erin Ficker to start off.
Thank you so much, Rebecca, for getting us started. My name is Erin Ficker. I work with the Great Lakes PTTC, and we are really delighted to be bringing you this webinar today. I have been working with the Great Lakes PTTC for about 6 years, and I am here in Chicago, Illinois. But as these names and places are scrolling by in the chat at just breakneck pace, I can tell you so many of them are familiar to me. So welcome, everyone. We're going to learn a little bit more about where you're from in just a minute. But before we do that, I would like to introduce or have actually my co-presenters introduce themselves. First, Michelle Majors is kind of co-facilitating with me. So you'll be hearing from both of us as facilitators. So Michelle, if you want to say good morning, afternoon, whatever it is.
Hi, everyone. Welcome. Oh, I think I'm freezing there.
Oh,
Glad to be here with you. Okay.
We're happy to have you, Michelle. And then I'm more than excited to introduce to you Isaac Wolf and Sarah Myers. So Isaac, I'm going to turn over you to introduce yourself. Tell us a little bit about who you are and where you're from.
Hey, everybody. My name is Isaac Wolf. I live in Washington State, have my whole life. The more I travel, the more I'm convinced I'm in the right place. It's a beautiful, beautiful state if you've never been out here. We have deserts, mountains, forests, all the things, anything you could want to see, the ocean. Anyway, enough of Washington. I live in Western Washington, but nowhere near Seattle. So different kind of zone. And I currently work for the Washington State Healthcare Authority in the Division of Behavioral Health and Recovery, in our prevention, SUD prevention and mental health promotion section. But I'm coming to you today with the hat on of steering committee member of the Rural Network, along with Sarah. I have a blue collar construction background. And then about 12 years ago, I saw my grandson for the first time when he was born and decided I couldn't just work for money anymore. So I went back to school to become a teacher, which led to student support, which led to public health and now to state work. So that's a little bit about me. Sarah, you want to go?
Isaac, so good to learn a little bit about you. And Sarah, I'm going to turn over you to give us a brief introduction of you.
Hello, I'm Sarah Myers, and I also work in Washington State with Isaac, and we're both steering committee members of something we have here called the Rural Network. I live in Garfield County, Washington, which is also nowhere near Seattle. I'm between Spokane and Walla Walla and the Idaho border, if you're familiar with any of those locations. Garfield County is the least populated county in all of Washington State. We have about 2,000 people in our entire county. It's another slide in of itself, but I am a Drug-Free Communities Coalition coordinator, and our coalition has been around for 11 years, and we also have state funding as well.
Great. Well, thank you so much for introducing yourself. We're excited to have you here and learn a little bit about you all. I definitely saw some folks in the chat from Washington State. I'm myself from Washington State, so we're really excited to have you here. Saw someone from Stevenson, Washington, which is one of the, is a rural place that I actually know about and have been to. So look at that. Okay, so let's keep going. So we're going to be talking about working inside of rural communities and what that's like for us as prevention providers. Our objectives today are to understand the challenges that face rural prevention providers, talk a little bit about overcoming those challenges. We're going to talk about the Rural Prevention Network and the Rural Prevention Toolkit that they've created, and learn about what Isaac and Sarah have been up to and how they help and support rural prevention providers in Washington State, and how that can connect and help us think about how we can connect. And then we'll discuss ways to increase connections and networks. So I just keep seeing so many people from all over the country. And so we'll go on to our next slide. So those are our objectives for today. And because I've seen so many people go so quickly through chat, I want to know a little bit about you. And the way we're going to do that today is really, in this presentation, understanding you, where you're from, and how you see things is absolutely essential to this presentation and this discussion today. So in an effort to make sure we hear from as many of you as possible, we're going to be using a feature called Mentimeter. I'm not sure if you're familiar with that. There are two ways to engage with Menti. The first would be to use that QR code, and you can just hold your phone up and use your phone to take a picture of that QR code and direct you there, and you can use your phone as you're watching along. We also just put the link to Mentimeter in the chat. You can use that link. Once you follow the QR code or use that link, you can actually keep that up, and we'll be using that same link every time. Or you can refresh it either way. But we're going to go there right now and ask our first question. So here we are in the Mentimeter. Again, each time I show this screen, this is my screen, not what you're going to be seeing. You can use that QR code to get there, and I'll start to see how many people we have logging in. So we really want to hear from you today, and the way we're going to do that is first to find out where you're from. So on your phone, you can just, see if I can get back there, you could just click where you are. Oh, I can see you guys are doing that. And I believe on your screen, you can do the same thing. So it looks like we have people bouncing up from all over. We have some people from Southern Oregon, Western Washington, Tennessee, Wisconsin, Michigan. Oh my goodness, you guys are, first of all, you guys are really good at this. Thank you. And second of all over. It's so exciting. We have folks in Florida and Texas. I saw someone who said San Antonio earlier. We have a lot of folks from, wow, Wisconsin's showing up with 15 folks. Now we can like have a competition to see where folks are coming in from. Southern Illinois, I love you. It's great to see you. We also, looks like we have New York State. I'm really bad at the Northeast states. I apologize to you in advance. And we have folks from all over the Pacific Northwest as well. Wow, you guys, thank you so much for taking the time to do this and show us. This is really a great graphic for us to see just how far and wide we are spread, and how the issue of working in rural communities is not confined to just a few areas, but is really throughout the country and in every state. So thank you to everyone from South Dakota, Nebraska, Iowa, Minnesota. Oh, Northern Michigan. I was going to say the UP, but Northern Michigan, Oklahoma, Louisiana, Texas, all over the country. Oh, even Southern California. So thank you so much. We're going to go back to the slides. And we will be coming back to Mentimeter. And as we go back to the oops, that's the, there we go. As we go back to the slides, we are going to turn it over to Isaac and Sarah from the Rural Network and talking about supporting prevention in rural communities.
Thanks, Aaron. Okay, yes, we are excited to be here. As Aaron said, we're beyond excited. So just a little bit of context. This is a slightly adapted version of what we presented in person at the National Prevention Network last year in Birmingham. So if some of you were there, thanks for coming again. It's going to be a lot of the same kind of content in slightly different order. But we're just really excited to be here because the whole point of going to NPN in Birmingham was to inspire other states to do what we've done. So if that's the takeaway that you get out of this, that's what we're hoping for. But of course, we can talk about all kinds of things throughout that process. Yeah, let's jump into the next slide. Okay, so first of all, we kind of want to, the first half of this presentation, we're going to be talking about rurality and prevention science in general. And then the second half, we'll get into specifics about the rural network. But first off, what is it? What does it mean to be rural? That word gets thrown around a lot, and some people want to put like little neat boxes around it, and other people want to expand it fairly broadly. So when we started, we really had to kind of think through that and think, okay, well, what are we going to call rural? Like when we're thinking about a support network that's designed to help mostly SUD prevention professionals, but really anyone who's trying to do behavioral health work in small towns in Washington State. How are we going to define that? So we wanted to make sure that everyone, like, self-identification was an option. So regardless of what other definitions we came up with for rural, we wanted to make sure that people who said, well, I don't meet that definition, but I feel like I need to be there, then they were welcome, right? So we left the door open. Intersectionality is a really important part of rurality. Like there are things that we can't help that makes it difficult for us to move through the world. Maybe our family history, or our sexual orientation, or our skin color, or religion or cultural heritage that might make it challenging to move through the world. All of those things get more complicated when you're also rural. So that was a really important part of our definition starting out. We wanted to also really lean into values and beliefs. Like the value system that defines rural communities is often supersedes other value shifts. So you might find, folks of two different cultures that don't have a lot in common, but if they're both rural, suddenly they share that rural value set. So that was a really important thing that we wanted to lean into. The data for rural communities is very different. A lot of times you don't have the sample size in order to actually get down to the results you need. So, if you've ever gotten a data report on your town or your school district or your community, and you see a whole bunch of them, it just says data suppressed because it could be self-identified, it could potentially be identifiable. Then we feel you, like that. That's when you're rural, is when half of your data sources are suppressed, because you could immediately identify who it is that's reporting on that particular data point. And then just the grassroots nature of it, just understanding that rural communities and rural work happens at a different pace. It happens in different communication modes, ways that we might not be familiar with at like a state or federal bureaucratic level. So recognizing that, respecting that, that was a really important part of how we got started and what we continue to do. Let's go to the next slide. Yeah, so this is a map of the United States, basically showing non-metro counties. And as you can see, my goodness, by geography, we are a rural country. And this is not the case in many parts of the world. You know, you might see a very different looking map if you were to show the same map of like parts of Europe or Asia or, you know, even parts of Africa. There's a very uh, uh, there's a lot of distance between our high concentrations of people. So that's just something that is important to recognize. Even Washington, I think we get sort of a national reputation as being, you know, populated because people know of Seattle and they think of it as a fairly large city, and it's the source of some various cultural influences over the years. But most of Washington is really quite rural. So, um, so we wanted to give you some like a slice of the rurality of Washington. So we originally we had 4 of these, but we wanted to provide you with 3 snapshots of 3 different communities, 3 different areas in Washington. So Grant County is about right in the middle of the state. It's between population centers, very rural, you know, total population 2,200, 83% Hispanic Latino, 17% white. Um, but you know, Grant County, when you're driving through it, it's actually the potato capital of the state. So there's more potatoes that come out of Grant County than any other county in Washington. Maybe not more than any other state, but definitely lots of potato fields, lots of agriculture, lots of farming, and lots of culture, lots of heritage. Right? There's strong cultural traditions, and the food is amazing, and you know, families are really important. Sibling groups stay together for, you know, are much more dedicated to each other. You know, extended family, you know, they like the idea of saying, you know, offering caregiver education to parents of 10 to 14-year-olds, for instance, doesn't really track because everyone's raising those kids, right? You know, you've got aunties and uncles and grandmas and grandpas and great grandmas and great grandpas that are also helping to raise kids. So you know, the pride is an important part of that. Pride in what you do. A friend of mine, Jason, said that you know, good work consists of pride in craftsmanship and a sense of urgency. and I like that when I think about like places like Grant County and other places where I've lived and worked. That those both of those things come through really strong. Like we do good work, we're proud of it, but we got to get this done because there's things to be done after that. So let's move, right? Uh, so that's Grant County. Let's go to the next slide. Yeah, let's go. So Morton, this is a little closer to where I live in Western Washington. I live in Lewis County, which is right between, like halfway between Seattle and Portland, on the I-5 corridor. And it's very rural. So Lewis County is the most eastern Washington of the states, or of the counties on the west side. I believe it's very rural. Culturally, maybe not geographically. I think from an isolation standpoint, Clallam County out there on the tip of the Olympic Peninsula is a little farther away from the metro areas, but Lewis County definitely has that vibe and the population total. So I just picked as an example the town of Morton. So Morton, it's a population of about 1,000 people. It's about 2 hours to the closest Target. So Sarah and I have come up with a definition of rural as your drive time to Target. I don't know if y'all have Target every part of the country, but out here, Target is kind of the big box store where you can get all the different things that you might want to get, especially clothing, you know. But it's about 2 hours to get from Morton to a Target. Um, you know, there's a definition of industry in rural communities. So like what is the primary means of earning a living and producing things? In Morton, it was logging, always has been. But they're kind of logging and lumber mills. But as those have been shutting down and changing and the forestry industry has really shifted, Morton's kind of in an identity crisis. They don't quite know what to do with themselves. There's still a lot of timber industry going on, but there's also, other people sort of pushing for this, that like they have a medical waste um, incinerator plant in Morton, which is like an odd newcomer to town, but it's hired a lot of people and, yeah, let's do it. But it's just in an interesting transition point. And because of those transitions, the politics are pretty complex too. There's a lot of differing opinions. People move to Morton because it's beautiful, it's in the mountains, and so folks move to the Morton from the city, and they've got sort of big city values and big city ideals, and they want to make Morton an arts and culture destination, that sort of stuff. And the folks who've lived there forever, like, where did you come from? What's going on? So there's some confusion there, some conflict, but also a lot of collaboration and a lot of common ground finding. So less conflict than you might think. And like a lot of small towns, the youth there kind of report feeling stuck. They just don't know what's next, where they fit in. They have access to the world in their pocket, and they see all these opportunities and all these options, but which ones of them are theirs? They're not sure. They're not sure what to do with that information. So that's enough about Morton. Pass it off to Sarah.
All right, so I don't have an echo, do I? We were having sound issues earlier.
Sounds good.
Great. All right, so my county, like I said, is Garfield County, and someone noted in the chat that frontier communities are also a lot of times left out of the rural conversation. So for those who don't know, a frontier county is another census sort of designation where it's less than one, I believe it's less than one person per 100 square miles. You might have to fact check that on your own, but think of rural, but even more isolated. So Garfield County, Washington is considered a frontier county. So our county population is about 2,400 people, and people use the terms Garfield County and Pomeroy sort of interchangeably because we have one zip code in our entire county. So if you're from Pomeroy, you're from Garfield County, and if you're from Garfield County, you're from Pomeroy. We have a little tiny, the town probably has about 1,000 people in it, and then the other 1,400 people live outside of that town. So even if you live 20 miles from town, you still say that you're from Pomeroy. I think a really important thing to highlight in sort of the definition of rural is how isolated you are. So you might be able to see horses out your back door where you live, but if you've got a Target down the street and you can get to all your doctor's appointments within 15 minutes, you might not be as rural, but we still love you. So isolation is like a real key in that intersectionality of folks that we're trying to serve with the rural network. So one of the things I put in my notes is that if you have a service provider in some of these rural counties that you don't really like, you can't really just find a new dentist, right? So if you might have one dentist in town and he's there only on Thursdays, like might be only one day a month. So in our county, we have pretty low level of services in a 30-mile radius. And then we are mostly white, middle-class farming community. And for those of you who are in the wheat farming business, you might know that over the years, wheat farming takes fewer and fewer and fewer people to actually harvest. So back in the day, they had to use single bed wheat trucks, and you'd have to have 3, 4 drivers. Now you can get the same amount of wheat to sale with one driver. And so our job market is kind of holding steady, and there's just no growth. I think Garfield County is consistently the only county in Washington state that does not grow in population. So holding steady to our one industry, which is wheat farming, but it's really the jobs in there fewer and far between. So we're going to move into our first Mentimeter after the map. And so describe your community using 3 words or some short phrases. We know that a lot of rural communities share a lot of the same traits, but a lot of them have their own unique traits. So once again, you can take your phone and scan the QR code. And if you want to use the desktop version, I believe it's in the chat. There it is.
And so as you come to this, you'll have an option to list 3 words or short phrases to describe your community. We heard a lot about the rural communities in Washington state that Isaac and Sarah are from and that are represented in their network, but we'd love to hear from you a little bit, just 1 or 2 words about spread out. Here they come. We're going to do a nice.
Oh, this is going to be fun.
This is Casey's General Store. Please tell me it's Casey's General Store where you can get pizza all over the Midwest. Rural, it's spread out. It's conservative, tribal, skeptical. This is coming so fast. This is great. You guys keep it coming. Borderline to Appalachia.
This is just going to get bigger and bigger.
I hope the conservative, rural, tribal, farm. What they keep coming. Yeah, low income, bad job market, farmland.
Dollar General.
Dollar General.
We got our Dollar General. We got our rural cred.
Casey's. I love Casey's General Store. Low resource.
Tight knit.
Oh, I didn't see that one. Traditional, closed off. Oh my gosh, you guys, this is great. This is a great word cloud. And you can see, even though it keeps changing and some of them are getting smaller, what we see is there's actually a lot of overlap. I saw tourist destination. I saw tourists. I see likes cheese. You're from Wisconsin. I know you. I see you.
I keep following hot chicken around the cloud.
Oh,
every
hot
time
chicken.
It moves.
That's got to be Tennessee, right? I see a lot of close knit, low income. I see traditional, conservative stays right in the middle. They're beautiful, farming, small, tribal, isolated. I see keeps coming up as well, or versions of isolated. You guys keep this coming. This is amazing to see as we go through here. We have 236 responses. That's so great. And I believe that we can share this word cloud with you guys later. But thank you for taking the minute to share a little bit about your communities. And I actually saw clicky, corn, farm, passion, sliced up, resource. I mean, I could go on all day. So thank you guys for taking the time to do this. We're going to go back to our slides and listen to a little bit more about what Isaac and Sarah have to share with us, and we'll come back to Mentimeter in a little bit. So I'm going to turn it over. I think I'm going to turn it over.
Yes, I will get it switched over here. And the one thing I just wanted to mention was the more time the word was said, the larger it is on the screen. So when you see like low income or conservative, rural beauty, friendly, that several people were responding to that one.
Mm-hmm.
So I don't know if there's anything else you wanted to say on this, Sarah or Isaac, before I switched it back over to the slides.
No, this is beautiful. I love that we're incorporating this Menti, because one of my favorite parts about presenting in Birmingham was the just sort of muttered affirmations that we got from the crowd, people saying yes and amen and absolutely, and or just turning and whispering to each other. I was a school teacher for a while before I got into public health, and my class was not they were not quiet. Like my classes, they knew they could talk to each other. They could say, what was he talking about? So this Menti option for me is just it's a nice fill in for that. Yeah, let's jump back into the content here. So one of the things that we noticed right away when we got, well, even before we started working together on this, was that there are a lot of paradoxes in rural communities, and in rural culture. So poverty and wealth, like we talk about, like when you talk about like wealth distribution and like inequality of wealth, like Bill Gates, or the billionaires are all on the news throwing their money around, and everybody goes "Grr," and grumbles about it. That kind of thing, that same thing happens in small towns. Like I can't think of any town I've been into that wasn't owned by like about 3 or 4 families, right? There's like 3 or 4 families that have been there since the beginning. Maybe one of them actually platted the town originally off of a a stakeholder thing that they had, or in tribal communities, sometimes it's where there's just a few families that have a lot of property, and then others who are just kind of scraping by, and not a lot of folks in the middle. It seems like the rural communities have very high needs, and also a lot of privilege when it comes to wealth. And that's sort of a weird dichotomy that you don't often see in other kinds of communities. Um, Hardship, privilege, those things seem to exist simultaneously in the same space, and it's hard to tell who has the money in town because everyone's wearing the same outfits basically. Um, and then the strengths and weaknesses aspect of rural communities was really interesting. Like when we're talking about SUD prevention specifically, and we start looking at those common risk and protective factors, um, some of our most like alarming risk factors in a different expression are also a protective factor. So the cliche saying of, you can't throw the baby out with the bathwater, that really comes up a lot, because it's like, if you're going to address some of the extreme risks that cause people to get into drug use or other behavioral health challenges or problem behaviors, um, you're you risk getting rid of something that is really valuable to that community and that culture, and how they conduct themselves. Um, you know, we can there's numerous examples of that. We actually ended up hiring a qualitative researcher named Janessa Graves from University of Washington to help us kind of map all that out. She's still working on that, so we don't have the results ready to share. But we found it over and over again that where, like for instance, a sense of solidarity, a sense of like we've got each other's backs, and we're in this together, and everybody, is pulling for all their neighbors and everybody else, and that really strong sense of community can actually be a challenge, because that strong sense of community leads to mistrust of state systems or federal systems. It's like, no, you guys can't help us. You don't know us. We don't need your help. We'll be fine. Go away. Don't get in our business. Don't talk to us. So that mistrust, if you try to address that directly, and say, hey, you should be more trusting of outsiders, well, that's just breaking into that strong sense of community that's been so important and valuable in the development of their culture, of who they are. So that paradox of strengths and weaknesses has really popped up a lot. So, yeah, rural challenges. Sarah, I think this one's yours if you want to kick it off.
Yep. Yeah, so I really loved our word cloud, because I feel like that was a perfect segue into really the meat of our presentation, which is this paradox. I really love what Isaac was saying about how something that's a risk factor is also a protective factor. Like your community is so tight knit that they almost have a hard shell around them, right? And it's like almost can't even penetrate into changing those values and norms. So we're going to talk about some real rural challenges. Distance and technology. I've seen in the chat, hey, I have poor internet. I can't join. I'm moving to my phone. we all know the technology challenges. Distance. If you have a coalition meeting in an area and it's pretty rural, you might have to have people driving from 20 miles away. Recruitment of all of the 12 sectors. So if you're working with a coalition model that uses 12 community sectors, you might have 2 or 3 of them that doesn't even exist in your community. A lot of times you don't have media, or you might not have law enforcement because you're really don't have a police force. Limited volunteer pool. How many people have heard the term STP? Same 10 people. Your volunteers are already volunteering for everything else. So it can be super, super hard to stretch people even more thin than they already are. Identification and use of local data, like we talked about, it might be extremely difficult to get data on your exact community because either the data is suppressed, or you don't have access to it, or they don't participate, or you have to look at county level data and you can't really suss out just this area. Gatekeepers and power players, so formal and informal folks. So I like to use the example of a made up woman, let's call her Mary. And Mary may not have a title at all. She might just be Mary. But if she's not in on your program, then it's not going anywhere. But if Mary is involved in your program, you are skyrocketing to success. And these people are informal. They probably lived in your community for 50 years, 30 years. Maybe it was someone who worked at City Hall for 30 years, or maybe it was someone who worked in the school. And so when you're going through the sector requirements that our grants have, and they give you like, okay, you need someone from this, you need someone from this, and your folks who are super influential in your community, they're real change makers, they might not fit into those 12 sectors, but you still need them on your coalition. All right, so I think we're on next slide.
Yeah, so this one I'm going to take the first half of that, and then Sarah's going to jump into the second half. I want to talk about fiscal agents really quick. This is a potentially touchy subject. So let's say if you're not familiar with what a fiscal agent is, it's basically like the person or the entity, the organization that's holding the pocketbook. They pay the bills, they make sure the grant program or strategy or funding sources is all the T's are crossed and I's are dotted. And fiscal agents can be tough to find in the community that you want to do the work in. So if you've got a very small town and maybe the only real kind of like service organization is a school district, and they're understaffed and behind the 8 ball on a lot of like learning targets, and it's just very, very difficult for that school district to even do its basic duty. Asking them to be the fiscal agent for a prevention program or grant it's next to impossible. So then you go to maybe like a regional person, someone who also serves that community, but they're actually located in a town far away. And that just, sometimes it works and sometimes it doesn't. A lot of times it's because they're, that old mistrust situation that pops up where maybe that organization or somebody else from that community promised to help that small town a long time ago, or even last week, and then didn't come through, right? They said they would do something and then they didn't. And so the people in the small town, they just kind of learned to not trust them. So if you've got someone who, even if they're from that town, but on their business card, it has the fiscal agency of that organization that's from a community 50 miles away, automatically you're behind the trust barrier, right? People are already going to say, wait, I don't think you know us. You're not going to be able to help us. So that's a big challenge for sure. fiscal agents, the good news on that is that they can do some things to become more relevant and trustworthy within their communities that they're supporting. The other option, obviously, would be to work with fiscal agents that are in the community, but help them to build a more business capacity so that they can cross those T's and dot those I's with more regularity. And that's, I think you see a mix of those two things, helping regional fiscal agents become more competent and culturally sensitive, and finding local fiscal agents and then training them up and helping them with technical assistance. Sarah, you want to handle the second half?
Yeah, so we kind of already covered those technical challenges with internet speeds. I also wanted to talk about Zoom. So during the pandemic, Zoom was a boon for a lot of rural communities, especially when they were really spread out. No, people were like, wow, Zoom's been around. I never knew about it before the pandemic. And so they were able to jump on together. But then other communities did not take to Zoom because it was so foreign to them. And so I'd be interested just in a quick, not everybody has to pop in, but if you had a strong feeling about using Zoom during the pandemic in your coalition, internet speeds and the culture clash of technology, our community wouldn't jump on in a virtual class where another community might think that's amazing. We've kind of already covered the data gathering and analysis. In order to get the data you need, you really have to zoom out to the county or the region, but that doesn't really capture your local conditions and that qualitative data that you need. And then your reporting, low numbers, privacy concerns. In our rural community, there's that distrust of government that is not entirely out of context, is not entirely unwarranted, but we have some folks who don't feel comfortable giving their birthday because they know that we're a government-funded program. So the drug-free communities model, I love their tagline, which is local problems require local solutions. And so I think the coalition model is beautiful in these rural communities because as the coalition coordinator or as the prevention staff, it's your job to get the requirements that your funders need and translate them into culturally competent for your community. All right, I think that covers that slide. So next slide. All right, differences, really. Slow trust building. Like Isaac said, these communities may have been burned in the past. One comment that I got a few years into our grant was, well, this program will be gone in a couple of years anyway, so I don't think we need to invest in that. And this person said it to me at a meeting that I was at, and she was expecting me to nod along and agree with her. Like, well, that's new, probably won't stay around for long, so let's not focus on that, let's focus on this. So they're slow to build trust, and I will say, I'll give them, it's not necessarily unwarranted. So in these communities, you have to build trust. You really have to build trust, even if you're from that community. So I'm a coalition coordinator in a community that I was born here, I was raised here, I am from this community, but I'm still presenting something to the community that is all new, or it can be all new. So please just don't feel discouraged if you're slow to building trust, because I personally believe that this field is, we're in it for the long game. We're here to build long-lasting relationships, and to me, that is just a point that I can't drive home enough. So rural values, we talked about this a little bit in our word cloud, that solidarity, interdependence, and civic pride. Those things can be such protective factors, and they can be such a gem for doing this type of work. That civic pride around your school, civic pride around volunteerism, the solidarity, if you can frame the issue in a way that gets folks excited but not overwhelmed. The interdependence of systems can be either like Isaac has been talking about, a paradox. Your community is very interdependent on multiple systems because there isn't enough of one thing to completely work by itself. So like, for example, your health district or your school or your law enforcement, everybody has to work together by default, so that you really have to get that that interdependence. But it could also be a burden, because maybe bridges within the community have been burned in the past. And Isaac, I think you're going to be covering that later, but I think that is so important. If you're a new coordinator or you're working in a community that you're not familiar with, you are the facilitator of this work, and you don't have to be from the rural community to facilitate work in a rural community. But you might be struggling. You're like, gosh, I can't get so-and-so organization to come to this meeting. You might have to ask around your table and say, hey, is there anything I should know about this organization or that organization? And someone might say, yeah, well, the A department stole a big grant from Department B 10 years ago, and they're still mad about it. So, Isaac, are you taking the second half of this one?
Yeah,
That
yep, that's
innovation.
me. That's me.
Perfect.
So integrating rural innovation. So this serves as like a differences slide, but also a bit of advice. So if
Yeah.
if you came to this webinar hoping to learn more about how to work with rural communities, this slide and some other slides are going to be the most helpful to you, because it'll help you hopefully to frame your strategies and processes. Now, sometimes your strategies run into policies that you can't affect or change, but at least acknowledge it. At least you can say, okay, this is what's in my way, and be honest with it. With the community you're trying to reach and connect with, just be really open. One of the things about rural communities is they are very good at innovating, very good, because they have to be. I call it duct tape and baling wire. If it's 2 hours to the closest machine shop, and you can't get the part that you need to fix the thing that's going to do the thing, you will figure out a way to make it work in the meantime until you can get it done right. That is not a bad thing. That is not something that should ever be punished or considered like people were trying to get away with fraud or being shenanigans or something. It's innovation, and it's okay. As a grant manager, like, I support communities who are trying to implement a very complex and ambitious grant here in Washington State. I listen to them and I say, all right, so you're saying you can't do this thing, but why? Tell me what you can do instead that would be sort of like that. And they kind of talk me through it, and I say, all right, what if we enhance it with this piece of evidence-based processes? Or what if we kind of spiff that, as somebody put in the chat? Like, what if we kind of, so I work with them to help their innovative side come out, so that they don't feel so disregarded, because that's a skill, it's a talent that rural communities have, because they have to. In-person relationships, I can't underestimate the value of those, man. If you can get, if you send out 1 million emails and phone calls and you're not getting any responses, that doesn't necessarily mean that they're not interested in your program or your grant or your opportunity. It just means it doesn't exist for them, because a lot of rural communities still operate almost entirely off in-person interaction. So if you're trying to talk to, a city leader or um, a nonprofit organization in that community, and they just don't seem that engaged, call them and ask them, hey, would you mind if I just drove out for half a day and just met some people? And they're probably going to say sure, and we'd love to show you around town, because they love their town, right? So they're going to take you to the best burger place and show you where the good coffee is, And then you can really start to establish who you are to them. Then emails are going to be a lot easier to get responses to. So just don't underestimate those values of in-person relationships. You don't have to go out there all the time, but at least once at the beginning, and then periodically throughout the process, it can really grease a lot of wheels. And then finally, I think we all need to acknowledge that there have been this is totally my theory. So this is not this, but based on a lot of different books I've read, experiences I've had, personal, professional, etc. I think there are three major betrayals of rural communities over the years. And I break them down into three buckets: the betrayal of economy, the betrayal of access, and betrayal of culture. So betrayal of economy, rural communities used to own more of their products. So that town of Morton that I mentioned earlier has several active lumber mills in their community. The owners of those lumber mills are big multinational corporations with headquarters far, far away. And the products that they produce, 90% of them are packed up, taken down to the port of Seattle, and shipped over to China. Meanwhile, at the local lumber store in Morton, the lumber you purchase is from Canada. So that's weird, right? Like you can't go buy a stud that was cut down from a clear cut that you can see from your house. You can't buy that stud. You can't buy that piece of lumber in your town. That's a weird economic system that has been enforced onto rural communities. My friend Jimbo is a chef. He can't go down to the seaport fishing docks where that's right, like small fishing town in Alaska. He can't walk down to the docks and buy a fish from any of the boats because they're all spoken for. They're all being frozen and shipped off to California. He can't buy the fish that are coming into his own small fishing town. it's so it's just that kind of thing happens over and over again, and it creates this sense of desperation on the part of rural communities. Betrayal of access, that's just, we've talked about that. It's just you don't have the services that larger communities have. And betrayal of culture really boils down to a decreased opinion of rural communities in our overall pop culture. It doesn't get as much recognition, and in many cases it just gets straight up mockery. Even when I was a kid, there was a show called Hee Haw that was basically like a cartoon lampoon of rural culture. You know, and I remember thinking, that's not what it's like here. That's that's weird, like the hayseed and just all that stuff. It just it wears on you, it wears on you when you see what other people's idea of what rural is, and how wrong it is. It can be very exhausting and just kind of depressing in a way. So jumping back into Mentimeter, let's do it.
Yeah, great. Thank you. And you guys gave us some wonderful examples of challenges that make it difficult to come into a community, to work within a community, and what some of the reasons why those challenges might exist. So what we've done for you in the Mentimeter, and I'm going to jump over there. You guys can jump over there with the code, or with, is this gonna, I'm always okay, or with the QR code, or the link. You could jump over there, and we're going to ask you to rank. And we were just able to pick a few. So we picked 4 of the challenges that Isaac and Sarah kind of touched on in multiple ways. And we're asking you to rank them on what you're experiencing. So if you're experiencing low organizational capacity in your communities or in your work, you can rate that. And you should be able to, on your phone, be able to just move them up and down. I'm not sure, Michelle might be able to tell us how it works on the computer screen, but what we'll do is we'll start to see those move around as people rate the various ways that, the various challenges that they experience. So I'm going to give you guys a little bit of time to do that. In the meantime, we have heard some great stuff in the chat as our presenters were chatting and talking. So a lot of agreement with some of the challenges we saw around the same 10 people, about the challenges of rural community, and a lot of people, Isaac, who also are familiar with HEHA. So as we're seeing this, we have the responses are still coming in, which is about 60 people so far. Low organizational capacity kind of keeps popping up to the top, along with identifying recruiting partners as challenges that people see repeatedly. So
I would love to highlight a comment in the chat while
please.
these are coming in. Jennifer Gomez says county resources stay in the county seat and the outlying towns are not supported. Me and Isaac have talked about this. We call it big town, little town. And I don't know how many of you are in a county dynamic where there's big town and little town, and big town has all the grants and they're county-wide. Big town is supposed to be serving a county-wide program, but all the meetings are in big town, all of the stakeholders are in big town, and if little town even gets invited to the table, it's a miracle. So that is definitely something that we are hoping as the rural network to sort of get some equity in those situations.
Absolutely. Big town, little town. It's absolutely a reality. And we heard that in some of that, and we see some of those challenges appearing again. And someone saying that's not just a rural issue, right? So anytime there's big town, little town, or when you are, I know here in Illinois, we often have service areas that are 3 or 4 counties wide. So if you're serving multiple counties, it's the county seat of which county. And then that big town even washes out medium towns. So those challenges are real. We've gotten quite a few responses. If you're having any trouble with rating those, just you can also just put your top one in the chat. We can take a look at that. But it does look like what we're really seeing is challenges with technology kind of falling to the bottom of these 4. Not that it's not a challenge, but maybe something that we've been able to overcome better. That low organizational capacity and that recruiting of and identifying partners really rising to the top. We just kind of kept seeing those 2 bounce up and down to the top. If you want to keep answering, you can feel free to do that. Again, on your phone, you can just kind of move them around. I'm not sure how it works on the computer screen, but thank you for taking the time to share with us what your challenges are. So it is really helpful. So we're going to go back to the slides and go back to our presenters, but we'll be coming back here pretty quick because we really want to talk again about how you guys are addressing some of these challenges.
Yeah, so before we jump off, I did want to acknowledge a comment in the chat that kind of got me in the ticker. Somebody said, I don't know how to answer this, as it doesn't seem like just a town resident like myself would know this. Who to that person, I just want to acknowledge we're using a lot of language and words that you might not be familiar with. If you are just, as you say, just a town resident, you are every bit a part of this conversation. And I'm really happy that you're here and that you're listening and that you're curious. And if you have any questions or would like a more like real world breakdown of some of the stuff that we're talking about, I would be happy to talk to you about it. I think Sarah would be happy. I think the PTTC would be happy to talk to you about it. And just really anybody. It's a lot to learn a whole new language, a whole new glossary, all these definitions and acronyms and you name it that come with prevention. But especially in small communities, prevention has to be done by and is the responsibility of everyone, regardless of what words or fancy acronyms or training you've had. You need to be a part of it because that's where the change happens, is when the whole community is involved. So what can we do? Speaking of which, leverage collaborations and partnerships. That's just like kind of an obvious thing, but it also isn't. Like collaboration between, like we mentioned, big town, little town. You develop that regional collaborative, and the folks in those big towns end up just kind of dominating that conversation. Whereas if you develop a collaborative with people who are and communities who have similar interests to yours, technology allows us to do that now. And I strongly recommend that we do it. So like, for instance, in Western Washington, Morton is just one of a string of small towns that used to be dominated by logging on the west side of the Cascade Mountain Range. And I was just in one yesterday for a site visit in Concrete, Washington, which is almost up by the Canadian border. So I'm telling the folks of Concrete, I'm like, you need to talk to the town of Sultan and Granite Falls and Morton and Darrington and like all these little towns on that kind of share the same vibe and the same philosophy and some of the same challenges. So develop those partnerships now and keep them going and recognize that the most important thing we can do for each other is just to validate where we're at. Respecting local culture, understanding that not even communities that are similar in some ways are going to have major differences, and recognizing what those differences are and celebrating them, and saying, instead of being like, oh well, you guys are different than us, so we're not going to talk to you anymore, say, wow, look how different you are. This is really cool. Let's talk more. I want to learn more about it. Uh, um, Using quality data, like helping your state systems or your federal partners or whoever is kind of directing or funding or supporting this work, make sure that data sources are relevant to you and respectful of your situation, where you're from, and what's going on. And back it up with qualitative. Learn how to do a focus groups. Learn how to do qualitative interviews and key informant interviews. Get some training on that. Get some support on that. Hire somebody. If your grant allows it, hire somebody to come in, one of these anthropologists or participant observation types to come in and do a deep dive on what's going on in your community. And then just supporting the collaboration from funders, like making sure that funders are all on the same page. So if you have multiple funding sources or multiple agencies coming in and saying, we're going to help with this and that or the other, invite them to the same meeting so that they really know what the other one is doing and that they're not duplicating services or contradicting each other without knowing it. Because some of that kind of work can go under the radar in a larger community where there's more going on, but it definitely clashes in a small town. So we're back to the Mentimeter. Awesome. I love this, by the way. Mentimeter is really cool.
I know, I'm having so much fun with it. And also, y'all feel free to react, use the reaction button and give a thumbs up or a clap or a heart as we move along as well. So we're going to go to the Mentimeter, and what we want to do is have you tell us a little bit about how you address these challenges. And so I am going to go back there and we'll take a look. We're going to move on from that, and we're going to ask you, this is actually a short answer response. You're actually able to kind of type a little bit and it'll show up in some boxes for us. If you agree with someone, I think you can give them a thumbs up. So feel free to start. I think you should be able to just start typing in a little bit about what you found to be successful in addressing these challenges. One of the things that I heard Isaac say that, and talk a little bit about in that last slide, which I think is so important, is not just the work you do in the community, but connecting with people who do the same work in other places. I know there's some isolation that happens, and that happens for prevention professionals as well. So what we're seeing here is that someone went back to school. That's fantastic. Bringing people to the table from all sectors, making sure the community knows how and knows the why and how. Oh, I like that one. That is really important. And we can just continue to scroll down here if you guys want to see these. Isaac or Sarah, if you want to jump in on any of these, feel free. Focus on children and the rest will follow. I love relationships. Others that you guys are seeing.
One. Oh no, go ahead. I was going to say, I saw one that said, be out in the community so people can see your face and attend be present at as many community spaces. People remember faces, and over time you'll be seen. Yeah, that was kind of a strategy in my community. I started going to our Chamber of Commerce meetings for 3 years before I even had an ask. I just started going just to, when they go around the table, and I said, I'm Sarah Myers, I'm from the Pomeroy Partners Coalition, just so that every month several people would hear that just repeated. And these are awesome. I love these.
Yeah.
Helping
If you want
others
them
with
to,
their
if you
projects.
want them to come to your meeting, you got to go to theirs. That's like,
Yeah.
yeah, what
Absolutely.
you haven't said it yet, Sarah, but Sarah came up with the best definition of a prevention professional I've ever heard. She said, I am a professional community member. And that is
Love
so
that.
true. That is so true. It's like you're always on too. Like
Yeah.
you are a preventionist at the grocery store, in the salon, at the cafe, uh Friday nights at the football game. You are a professional community member. And boy, it can be exhausting, but it's also really rewarding when you can make positive changes.
I love that. And we're seeing so much here about being in the community, having personal relationships, making face-to-face. So much of what we're seeing is about communication and relationship building. As I'm scrolling through here up and down, and I'm sorry if I'm making anyone dizzy, you can also watch on your own phone or on your own internet, your own browser, so I don't make you too dizzy. But really what I'm seeing here just on kind of repeat is relationships, finding ways to connect, communicating, in a number of ways. And so this is great. And you can kind of keep these coming. I'm going to leave this Mentimeter open while we go to our next, go back to our slides, but you can keep entering your responses here and we'll be able to capture those for you. I'm not sure, I haven't seen, Michelle, if you've seen anything in the chat that
There
I'm going
was
to see if I, go ahead.
just a question if they would love to have a summary of all of these. So we'll see if we can print it and have it sent out with Rebecca, or if we can type them up. People would love to see some of the successes they're sharing in here.
I think that's great. Yeah, we'll see if we can get those out to you. I'm going to be honest, I'm a little bit new to Menti, so I'm not always sure what I can do, so we'll see. Great. So I'm going to go ahead and turn it back over to our presenters to kind of talk about the network that they created and how that's been helpful for them in their work. And again, that piece that Isaac mentioned earlier, which is connecting to other communities that are doing the same work that you are. So I'm going to turn it over to them.
Awesome. All right, so I can actually have you take us to the next slide and we'll just run through the structure. So the Washington State Rural Network was started, I believe, in 2020, and Isaac has a slide on the exact history of it, but our structure is that we are a statewide network for rural prevention. The Rural Network has 2 part-time staff. I think they actually just transferred to 1 full-time staff. They are DFC coalitions, they're state coalitions. It's our Department of Health, it's our healthcare authority. We meet monthly collaborate on rural needs, professional development. We actually have a biannual conference that we're super excited for. And we have presenters at our meetings. And then Isaac can go into the history of how that was formed.
Yeah, so back in 2008, the economy took a sudden turn with the downturn of the subprime mortgage lending situation, and that led to a chain reaction, which led to our tobacco excise taxes being diverted into the general fund. So it used to be Washington State in the early 2000s and 90s had a pretty robust prevention system that was funded by tobacco excise taxes, so taxes on packs of cigarettes. And when that was rediverted, suddenly we had a lot less money to work with. So we stopped funding by population density, because we recognized if we took the old calculation and just reduced it proportionally, some counties would end up with, you know, just a few $100s, because that's how much of the reduction we went from. You know, small counties used to get maybe 20,000, they would get now almost nothing. So we had to start thinking about funding all of the state sort of by geography and by need rather than by population density. And that led to the passage in 2012 of Initiative 502, which legalized recreational cannabis use. So the excise taxes from cannabis some of them were directed towards prevention, not as much as was promised, but just enough that the Department of Health created something called the YMPEP, the Youth Marijuana Prevention and Education Partnership, in 2015. In 2016, the YMPEP program decided that they needed to focus on priority populations by providing their YMPEP implementers, their local grantees, they needed to give them training and technical assistance on certain priority populations. One of those, so those training and TA contracts started rolling out in 2018. One of the priority populations was rural communities, just because there was a high disparity of substance use in rural communities. So, but they didn't have a training and TA consultant or contractor for a rural. So they finally put out an RFA in I think it was 2019. And the Prevent Coalition, which is a former DFC and now kind of prevention juggernaut here in Southwest Washington, put their hand up and said, yeah, we could do that. But once they got the contract, they said, all right, if we're going to do this, we're going to do it in the model that we know, which is coalition work. So instead of like saying, well, we know all about rural and we're going to tell you, they formed a coalition of rural prevention providers. And that was us, right? So I was one of the founding members of that. I was, quickly volunteered for the steering committee. Sarah was on that. We had somebody from our local school or statewide organization who ran the rural schools program. We just formed a coalition and we started working on what we would need to do. So today, here we are. And honestly, it was kind of weird because I don't know if it would have been as easy if the pandemic hadn't happened and all these rural communities suddenly got used to using Zoom. If the pandemic hadn't occurred, it might not have been as successful, honestly. So it's a little bright spot from everybody being locked up in their house for a few months. But so go ahead, Sarah. I think this one's yours. Yeah.
Yeah. So this one is pretty straightforward. Rural coalition work, rural prevention can be very, very isolating. You feel like you're the only one who knows what's going on, and sometimes you feel like you're the only one who doesn't know what's going on. Our work is so specific. We don't necessarily have coworkers, we have volunteers. And so when you get into a room of people who know exactly what you're going through, your shoulders drop, you feel like you can breathe, and then you just want to talk, right? So we connect rural communities. That's our first goal. We have monthly meetings. We usually get a speaker on. We do breakout rooms, and we connect every other year at our conference. And it just feels so like reassuring. And then obviously the second goal is reducing youth substance misuse in rural areas. So rural areas actually have a little bit different data for substance use, and that's our bread and butter, right? So we are able to pool sort of our resources and get some data analysis on rural Washington state. And our little tagline is so nice. It's a gathering of rural people who support youth on their journey to whole health. And next slide.
So I wanted to talk about the data a little bit because we talked about data challenges earlier, how data was difficult to ascertain for rural communities. So rather than saying, well, we don't really know what's going on in this little town or what's going on in this little town or what's going on in this little town, we said, how about we put all of the little town data together and then compare it to the big town data. And so what we did with that is we used what Washington State has an amazing, amazing thing called the Healthy Youth Survey. So askhys.net if you want to check it out. It's got a dashboard. It's got, over 200,000 valid survey responses every year. All counties participate. It's an incredible effort. It's multi-agency, so not one agency owns or runs it. It's It's a collaborative across a lot of different executive branches. It's been going in one form or another since the 90s. It's just a really, really great resource. But it had never been sorted into rural versus non-rural. So we did that. We actually hired a local health department from Southwest Washington to request the data set, which you can do, and then to add RUCA codes. So the rural urban commuting area codes. It's a federal designation to the data set so that it could be sorted. And then we found that, unsurprisingly, according to our local knowledge, there was a higher use of cannabis, higher use of vapor, higher rate of binge drinking, higher rates of cigarette smoking. We also found some interesting data around cross-sectionality that Native, Hispanic, Latino, and LGBTQ, while we are aware of the disparities for those particular populations in Washington state, those disparities increase when you intersect that with rurality. So also, fun fact, in Washington, and I think many other places, even though the city leaders or school officials might not see it this way, on an anonymous survey, when you're asking kids about their sexual orientation or gender identity, there is the exact same percentage of youth who identify as LGBTQ in rural Washington as there is in urban areas. So the differences are not the same, or there is no difference in LGBTQ status in small towns, at least in Washington. And I don't know if it's always been that way. I certainly grew up in a small town, and the friends I had there who later came out as gay or trans definitely did not when we lived there because they were afraid. So something to consider. And then when we're discussing disparities, we try to focus on risk and protective factors. So rather than talking about the disparities like I did with you all just now, I want to ensure that like when we're talking about disparities, like we don't want to say that, like, when we're communicating the disparities about rural communities, we don't say more kids drink in small towns. We want to say things like kids have a much higher access to alcohol in small towns, or there's less perception of enforcement by local law enforcement, right? So that people understand that it's the risk and protective factors that are driving the use, not just who they are or where they live, but actually the environmental conditions that they're exposed to, or the individual conditions that they're dealing with. Higher rates of trauma, higher rates of family substance abuse, that kind of thing. So and then we did a deep dive into the effects of positive adult relationships and positive childhood experiences, really trying to lean into the strength-based side of things.
All right.
Oh,
For the sake of time,
for the sake of time. Yeah.
Yeah, we're going to skip ahead to how to build your own network, which is Isaac again.
It's me again. Oh no. Okay. So 5 steps. We're talking a lot. I'm sorry. Anyway, so 5 steps to building your own network. And these are in no particular order because you might have capacity to do one over the other. But all of these can be done sort of simultaneously and in conversation with each other. So building a coalition, just making sure you're connecting with people who are going through things similarly to you. In your community, find people in other communities who are doing stuff and finding the same kinds of challenges. Turning your stories into data. So come up with a simple 3-question survey that you can put out to as many folks as you can, and then create a data set that you can then couple with your story. I tell people to make a data sandwich. So story, data, story. So one data point that you want people to remember, one number that they can take away, but then put a story on either side of it so that people understand that these are happening. These data points are happening to real people who matter. Finding your fiscal allies, finding that entity, that organization that can pay the bills on time, do the paperwork, cross those T's, dot those I's, and then just really making them your friend. It might be somebody you haven't thought about. It might not be a nonprofit organization. It could be the city government. It could be, a church. It could be, who knows who has that capacity within your community, but get creative and find that fiscal agent that can really support what you're trying to do. Establishing key goals and priorities, coming up with a simple list of things that you can do right away, and maybe a list of long-term projects that you'd like to change. And then celebrate. Oh my goodness. My good friend Dave Chevelle, he says when you do prevention right, nothing happens. And that nothing can get really discouraging. So definitely want to make sure that you're celebrating when you do things well. And wrap this slide up by quoting the amazing Anisha Cochran, outreach worker in Portland, Oregon. If you're not at the table, you're on the menu. So make sure you're a part of those policy conversations that are happening at the state level.
Thank you so much. And we have their contact information here, but I want to really make sure that there's two things that are highlighted. One is that Sarah put a link in the chat to the Rural Network website, and you can go to their website and check out all their stuff. When we send out, probably tomorrow, we'll be sending out a follow-up email, and that'll have in it a way for you to access some of their toolkit. They have been incredibly generous in sharing this content with us and some of the work that they've done as they have brought together rural rural communities across Washington state, and some of the things that they've been able to produce and the priorities they've been able to set. So please use the Q&A. I'm gonna, as I'm talking about, I'm gonna check it. So people would love to see the data report, so we'll make sure we're able to put as much in that follow-up email as we can. So thank you for that. Other questions? You can throw those in the Q&A. Also be sure to follow that link. You guys have provided a lot to make this this webinar really engaging, and we have Sarah and Isaac here for just a couple minutes or more, and so if you have a question, please feel free to ask it. If we aren't able to get to your questions, we can address those in a follow-up email. So I'm going to turn it over, seeing no questions, I am going to turn it over to Chris Gabrielson, and Chris, you can share with us what's next in the Great Lakes PTTC. And please, I would like to take just 1 second to thank Sarah and Isaac.
Yes, and I would like to thank them as well. Thank you so much. What fantastic information and what fantastic work you all are doing in Washington State. So great to hear about it. We do have some upcoming events that I wanted to make sure everybody knows about in case those interest you to join us for future events. One is coming up the end of this month, May 30th. It is a 3-hour training, interactive training, where you're going to be in breakout rooms, all those kind of things. So if you don't like those, stay away from it. If you do like it and you like to learn skills that you actually start applying right away, join us for that. But we are near the cap of our the number of folks who can join. So if you're wanting to join that training, sign up soon. June 4th, we have Jason Kilmer from the University of Washington, another Washington folk, who's going to present. And if you've seen him present before, he is fantastic. I highly encourage you to sign up for that webinar. If you are needing any continuing education credits for your certification as a prevention specialist, and if you need it for ethics, we have our last deep dive into prevention ethics for 2024 coming up on June 4th. That's another interactive training where you'll be in breakout rooms. You'll need a camera and microphone to participate. June 20th is a webinar on Media Literacy 101 for substance misuse prevention practitioners. That's going to be a good group. I believe we're over 400 registrants already for that one. June 27th, if you do any kind of presenting at all in your job, you present to parents, to coalition members, to funding agencies, I highly recommend you attend this training with Brian Kloss from Johns Hopkins. He's in their public health school. He's fantastic. Highly recommend that you join us then. this one's a little different. This is this training on July 11th is going to be for folks who are peer recovery specialists. So not folks that are already currently working in the substance misuse prevention field, but those folks who are working in peer recovery field. If they're wanting information on understanding primary prevention, this is the training for them. I wanted to make sure you knew about a new document that we pulled together. If you are interested in getting a nice concise list that's actually categorized versus if you go into healthy knowledge, where it's just everything's kind of all put together. There's not a really good sorting mechanism at the moment for healthy knowledge, but this is a document that will show you what courses for substance misuse prevention are available on Healthy Knowledge that are self-paced, free courses that you can join at any time and earn certificates for. If you haven't already, be sure to join us on LinkedIn and or Facebook. This is the way we get information to you right away. We post every day on weekdays with the latest information. So it's a great way to stay connected with what's going on. And last but not least, just to say one more time what Rebecca talked about at the beginning, that after the end of this session, you will be redirected to our GIPRA evaluation form. If you can take a few minutes to fill that out, that's incredibly valuable for us. We use it, of course, to report for funding, but even more importantly, it helps us understand what's helpful and what's not in these training sessions and guides us for our future training opportunities. So please be sure to do that. And with that, I will just say one more huge thank you to Sarah and Isaac, as well as Aaron and Michelle in the background. It was a group effort today. We also had Rebecca, who did all things production for this training. So thank you to you all, and thank you to everybody who, all the participants who were here as well. Any last thoughts from anybody?
Thank you.
All right. Thank you, everyone. Have a great rest of your day.
Thanks, everyone.
Bye-bye.